everybody here? Yeah, I mean, it's nothing overly significant, and that's the hard thing, right? So you can see it's got a little inclination there. We could check and have her look down and find C6 and C7 and come on back up. And so then again, we're looking between T2 and T7, that the scapula are located through there. Or if you'd like, you could go through the spine of the scap, and that should be T3, okay? We're also going to look at the relative position of the scapula. So we're going to maybe take a line here. I might turn you, we're going to look over a broad area of that medial border, and you can see hers is pretty vertical to slightly upwardly rotated. Same thing over here as we look at the whole picture along there, okay? So again, pretty neutral position, looks good from there. We're going to look at the ab or abduction. So just so I'm not making things up, we'll measure, okay? We're going to go through there, and you can see she's about 3.5 inches on the left, and maybe 3 1/4 on the right, okay? So again, she's right in that range of normal. Things look really good. We're going to... I was measuring for AB or abduction,
So
from the spinous process to about just around the spine of the scapula, okay? You're going to want to choose kind of a midpoint of the scapula to do your measure, because it can be influenced by upward rotation or downward rotation, okay? So that'll just kind of give you a relative landmark, okay? Then you want to look from a side view. So actually from the back, you can see it maybe a little bit through her medial border. Okay, that's going to suggest some of the internal rotation. But then as we look at it a little closer, we're going to just come from the side and just envision where that's pointed to. Okay, what's our landmark here in terms of how much? Right, about 30, 40 degrees, right? So she's pretty well on target there. It doesn't look overly excessive in terms of the internal rotation. Okay, and then again, that anterior tilt, we'll look at the inferior border and just kind of think about putting your hands on the scapula themselves and looking at what kind of tilt there is, okay? The only thing different here is maybe there's a little more tilt in her right side than her left, okay? But again, that's kind of the things we want to work through and move toward, okay? We forgot to kind of look at the thoracic spine, so we're going to kind of consider what it should be like, right? It should be in a little bit of flexion. We're going to get the overall picture. What do you guys think? Yeah, it looks pretty normal, right? The only thing you might see is she looks maybe a little flatter through here, and then most of her flexion comes from these lower segments, okay? And again, none of this might be a big deal, but it's just giving us clues about muscle performance, what might be working too much, what might be not doing its fair share, okay? Any questions there? All right.